Good morning, Chair Greenlake, members of the committee. I'm Bill Post, I represent House District 25, which is Kaiser, St. Paul, and Newburgh. I just realized this is only the third time I've sat in front of a committee like this, and it's not getting any easier. It's still a little weird. So I thank you for your time. I want to thank you for the opportunity to talk about House Bill 2128-1. If you hadn't noticed, there is a very important -1 amendment that is really the guts of this bill. As you know, it rains in Oregon. As a kid once said to me, it doesn't just rain, it pollinates in Oregon. And we seem to be the capital of hay fever, colds, and all that goes with it. And while pseudoephedrine products, and in this case, my bill has been affectionately called the Sudafed bill, Sudafed doesn't cure anything, it sure makes you feel a lot better. It makes life a lot easier. And I've heard from Oregonians all over the state about the desire to bring pseudoephedrine products back in a more responsible way. And in fact, on your OLIS, you can see many emails that we uploaded. Those are just a few. Most of them are from the Portland area because at this point they're frustrated enough to just go across the border into Washington. Today you're going to hear that bringing back Sudafed through this bill will return us to the days of meth labs with trailers and starving children. And unfortunately, the data shows that while meth lab use has gone down in Oregon, though that decline started before Sudafed was restricted, the use of meth has gone up because it's no longer being made in a lab in somebody's backyard. It's being brought over the border in pure liquid form. I'll be walking you through a presentation which combines two studies. Both studies are available to you separately on OLIS, the NAMSTL study and the NACSCA study, which I'll define for you. The NAMSTL is the National Alliance for Model State Drug Laws, and the other is, get that real quick, is the, I've combined these two reports to make it a little easier, but again, you can read them separately, is the National Association of State-Controlled Substance Authorities. So if you want to follow along, it's on the screen there, and I'm not going to read everything. I'm just going to touch on some things. In July of 2006, Oregon became the first state to require a prescription for products containing pseudoephedrine and ephedrine, such as cold and allergy medications. Mississippi implemented a similar law in 2010. Both states experienced substantial reductions in the number of meth lab seizures. In Oregon, the number of meth-related deaths has been increasing since 2007, with numbers reaching their highest levels in 2014. Meth has now surpassed heroin as the leading drug-causing death in the state. The research team concluded that the relationship between the PSE prescription laws and the decline in meth lab incidents is spurious for the following reasons. Similar decreases in the number of meth lab incidents occurred in surrounding states for both Oregon and Mississippi, suggesting a regional trend as opposed to a unique event in each of the two states' cases. Law enforcement agencies in Oregon and Mississippi report that meth supply has remained plentiful throughout the study period, with meth imported from Mexico making up for any lost domestic meth production. Mexican drug traffickers may have contributed to the decline in meth labs in both Mississippi and Oregon and surrounding states, as they were able to provide ample supply of equal or greater quality meth at competitive prices. Since 2010, over 100 bills have been filed in 27 states with prescription-only provisions, yet Oregon and Mississippi remain the only two states with the prescription-only mandate. Electronic tracking and block of sales to those exceeding quantity limits is the most common approach states are using, with 32 states having taken this step to regulate access to PSE. Recently, you may have read in the news, Multnomah County's biggest drug bust ever, February 23rd, 2017. About 100 pounds of meth highlights a new trend in this drug trafficking. Inside the home, agents discovered several more pounds of crystal meth, as well as canisters containing liquid pseudoephedrine, which is what meth is made from now. Liquid pseudoephedrine that's converted into crystal meth. The bust shows that the latest trends in Mexican drug cartels are using to avoid detection. Fascinating this was. They're bringing the liquid pseudoephedrine in gas tanks, car batteries, and windshield wiper fluid compartments into the U.S., where it is then converted into crystal meth or ice once it reaches the state or city of distribution. Law enforcement officials in Oregon note that in every meth lab incident that has occurred since the prescription-only law was implemented, where the source of PSE, pseudoephedrine, could be traced, the PSE originated from one of the 4 surrounding states. That came from the GAO in 2013. For both Oregon and Mississippi, not only did the number of lab incidents in those states drop after the law's implementation, lab incidents declined in surrounding states as well. The same basic lab incidence trends occurred in Mississippi's surrounding states, with the exception of Tennessee. All states experienced at least an 85% reduction in the number of lab incidents between 2004 and 2014. This is a little bit of a graph. I hope you can see that okay. What's interesting about it is there was a 99% decrease in lab incidents from 2004 to 2014. But what's fascinating about this chart is there were 632 lab incidents in 2004, 2 years before the law was implemented. The very next year, before the law was implemented, it dropped to 232, and before the law went into place in 2006, dropped down to 66. So it was already dropping before this bill became law. The reduction in lab incidents occurred in all states bordering Oregon, Washington, California, Idaho, and Nevada. All 5 states experienced at least a 95% decrease in the number of meth lab incidents throughout the 2004-2014 period. And you can see that line that shows where the law came in, the prescription law enacted, and you can see that it was already dropping before that. We had done a good job by putting it behind the counter. Law enforcement identifies Mexico as the primary source of Oregon's meth, with a small amount being produced in California and the Southwest. The report also mentions the number of meth seizures and pounds of meth seized has increased substantially since 2007, the year after the law came into effect. In 2010, forces seized 157 pounds of meth, but this number tripled to 578 pounds in 2014. Not only is crystal meth from Mexico, California, and Texas a problem, law enforcement still encounters domestic meth produced via the one-pot or shake-and-bake methods, but what they've found is that's usually for personal consumption. It's not being massively sold. The authors of the NASCA report that I'm referring to found no evidence of changes in methamphetamine consumption or arrest for drug possession, suggesting external sources of supply over national borders. The authors also found no significant impact for Oregon's regulation, as seizures here in Oregon, and nearby western states had largely bottomed out months before the regulation was implemented. Given that demand for meth changes very little with price, the authors state that their failure to find evidence for higher prices suggests that the disruptive effects of prescription-only legislation on meth availability is quite small. This may likely be due to international imports being readily available to displace domestic producers. The authors concluded that while prescription-only laws can reduce the number of domestic small methamphetamine labs in operation, methamphetamine availability is unlikely to be materially impacted. And while the authors acknowledged that a prescription-only requirement would likely reduce PSE purchase for illicit use and curb methamphetamine production and costs, their model indicated that a prescription-only policy would result in new physician visits and significant increases in out-of-pocket patient costs, as well as public and private payer costs. Now, my solution to this, not my solution, I wish it was, is NPLEX. It's provided free of charge on a permanent basis to state governments that pass appropriate legislation and regulations. That is what the -1 amendment is. This did not exist in 2005 and 2006 when that bill was passed. So the good intentions of that bill, which I admire because we had a horrible problem, is solved through this NPLEX situation. What I want to show you is that's just a screenshot of what a pharmacy would see or a police department would see if they downloaded the program. And let me just give you a quick overview of the program while you're looking at that screenshot. NPLEX is a public-private partnership offering a real-time electronic methamphetamine precursor tracking system free of charge to law enforcement, state governments, and pharmacists. The partners are the National Association of Drug Diversion Investigators. The manufacturer and the technology vendor is Appriss. I hope I'm pronouncing that correctly. The cost to the state government is none. It's free. Law enforcement officers simply contact Appriss and request the service. Upon verification, the officers receive a username and password and have access to the system. How does it work? The Federal Combat Methamphetamine Epidemic Act of 2005, CMEA, as well as numerous state and local laws require retailers of products containing pseudoephedrine and ephedrine to capture customer data at the point of sale. That's what this does. Why is real-time so important? It enables the blocking of sales, smurfing as it's called. What about server, software, hardware? It's entirely web-based. There's no server needed, no software, no hardware. You just load it onto your computer right off the internet or just use the cloud-based version of it. There's blocked sales. All retailers in the system voluntarily block the sale of precursors that would exceed any law of jurisdiction, including 3.6 grams per day and 9 grams in 30 days, which again we've written into the bill. Here's the interesting thing. How many stores are using NPLEX? Over 20,000 retailers in the United States in 36 states are currently using it, including CVS, Rite Aid, Super Value, and stores here in Oregon. The second to last thing that I want to show you is this was purely by accident. In September, late September of this past year during the campaign season, there was a company that did some polling that was used for the governor's race, for the Secretary of State race, and the presidential race in Oregon. They were kind enough to allow me to have this question posed to a very, and you can find all the crosstabs and everything on OLIS. Here's the interesting thing. I didn't even want this question asked over the counter. So think about this. People were asked, do you support over-the-counter purchase of pseudoephedrine products? You'll find, as it says, those 65 years and younger than 65 years are the strongest supporters. They were asked, as you may know, Oregonians are required to obtain a doctor's prescription for products that contain the drug pseudoephedrine, which is commonly sold in cough and cold products, such as Sudafed. This was done to fight the methamphetamine epidemic that was ravaging Oregon at the time, and the law was implemented in 2006. Would you favor or oppose repealing this law and allowing Oregonians with proper identification to purchase these products over the counter without a doctor's prescription? And as you can see, 57% said they favor this. Those are Oregonians. Oregonians want their pseudoephedrine products back in a simpler way. So I conclude with this. This is a bill to help the quality of life for all Oregonians. And I especially point out, because of the cost, I have to go to my doctor, and depending on what your doctor charges, $75 to $125, to tell me that I have the sniffles, to write a prescription for me that I have to take down to, I go to Fred Meyer North, and to get a product that costs more because it's a prescription now. When I just had a person email me this morning, I couldn't get it here in time, said they go up to Linwood, Washington Costco, show their ID, which is exactly what I'm asking in this bill, and they got 4 packages of Sudafed for $1.50 a piece. So I ask you this. This is a tangible step that we can take to make health care more affordable. And that's what you guys do on a regular basis. But I thank you so much, members of this committee, and appreciate the time that you've given me.